June is also Men's Health Awareness Month. So joining me now is Dr. Greg Reeser with Honor Health. Dr. Reeser, great to have you.
Hi, good to be here.
You know, what was interesting was last month, we obviously talked about Biden's prostate cancer diagnosis. Now we're talking about it again. And I appreciate what, this ESPN anchor had to say, that he wants to normalize the conversation about prostate cancer. And he also mentioned something about how Black men are at higher risk of getting prostate cancer. That was something new to me. Why is that?
True. Well, we think a lot of it is genetic, but there's also some lifestyle and other factors. Part of it too is sometimes men don't go to the doctor. And so one of the things that we really want to impress today is just getting men to go to the doctor.
I'm glad you said that because it seems like it's so much easier for women to get checkups and everything, but for men it seems so much harder. And, without the wives nagging to get their husbands to the doctor. But explain how important this is.
Well, we recommend that most men have a primary care doctor usually at age 40 to get established, and it's important that they go see them. So the goal of medicine is to try and catch things early so we can prevent them. So with prostate cancer, we want to do prostate cancer screening. Usually we recommend getting a PSA at age 50, unless you're a higher risk. So if you're African American or if you have a strong family history of prostate cancer, age 45 is the time to start considering getting screened.
Okay, so you mentioned the PSA risk. That is one of the 5 very important things that
Correct.
men should get screened on. Let's go through each one here. Blood pressure. Why?
Blood pressure. It's the #1 preventable cause of death in the world. And so, like most things in medicine, we don't know if you have hypertension unless you check it. And so we want to get it caught early because it's preventable.
Lipid panel. Explain that.
So lipid panel includes cholesterol, and there's lots of tests to try and assess that. But if you have a high cholesterol, whether it's from diet, lifestyle, or a lot of it's genetic, we want to catch that early because it's the cumulative risk of high cholesterol in your arteries over time that leads to heart attacks or increases your risk of heart attacks. So that's something we want to catch early.
Another important screening is the hemoglobin A1C. I always hear A1C, so explain that.
Yeah, so hemoglobin A1C is a test that basically looks at how your body processes glucose. So diabetes is something, adult onset diabetes is something we can catch coming 10, 15, 20 years early. So if we can catch an A1C being elevated early, then we can give diet, exercise recommendations, and sometimes medications. But it's always something you want to catch early because you don't want diabetes to go on too long because then you get all the complications.
You talked about getting the PSA checked. Last on that list is the colorectal cancer screen. That's not fun, but it has to be done.
It has to be done. So the gold standard is to get a colonoscopy. So the new recommendation is to get a colonoscopy at age 45. But for people,
Didn't it used to be 50?
It used to be 50, but we're starting to see that age is coming down. A lot of Chadwick,
Chadwick Boseman,
He died of colon cancer.
Yeah.
So there's been a movement, and this is substantiated by data, to get it decreased for screening to age 45.
Oh, and how often do you have to get that screen, though?
So it depends on family history, other risk factors, et cetera, and also whether or not your colonoscopy shows anything. And it doesn't have to be a colonoscopy. That's the gold standard. There are other tests that you can get as well, but that's usually the best one to get. So something to talk to your doctor about.
Wonderful. Excellent information. Thank you so very much, Dr. Reeser. There are several men in this studio right here, so I hope you're all listening. Very important, those 5 important things. All right, thank you so much.